All right, good afternoon. It's good to see a couple people attending our Q&A session for the 4 o'clock session. My name is Jeff Stowell. I am Captain and Assistant Director here at Grand Valley State University Police Department. I want to welcome you to this afternoon presentation. Hopefully you've been able to see and talk with some of our colleagues across the campus for other questions that you've gotten answered. But we are here as a police department and also our student health center. And I will let Susie from the health center introduce herself.
Hi everyone, I'm Susie Zimmer. I am the practice manager for the Grand Valley Health Center that is right on campus by the water tower.
Hi folks, Liz here again. I believe both of you have attended our earlier sessions today, so excited to see you again. I am the coordinator for Parent and Supporter Orientation. I'm excited to answer your questions about safety and wellness here at Grand Valley. I did want to make note of a few things before we get started. First is I am recording this session, and it will be posted on our Parent and Supporter Orientation website. So if you did want to look back through that, you would have access to it as well as others who couldn't attend today's session. So I'll put a link in the chat box for you to get to this video. Next, again, just like the other sessions, we are sort of treating this Q&A as under the assumption that you've already viewed our video presentations. So particularly for this one, our student safety video presentation. So we really are treating this as an opportunity for you to ask follow-up questions based on the information in that video. Again, it's fine if you haven't watched it yet. We do highly recommend that you watch it because there's a lot of good information in there, more information than we probably will get to today in this Q&A. So how today's going to work is similar to the other sessions. Jeff and Susie are going to go through a couple of quick PowerPoint slides, just chatting about some key important information in their areas, and then we'll bring it back to the group and open it up for any questions that you have about safety and wellness at Grand Valley. So with that being said, I'm going to switch it back over to Jeff and Susie.
So first, let me say, if you haven't watched those videos, you can watch them and see clearly why I'm in law enforcement and not an actor, having done that on a couple takes over the course of summer. But there is a lot of information on there. This is just one summary slide kind of talking about our department. We are a full service department here on campus, working 24/7, 365. We've maintained operations throughout the entire COVID pandemic. We've always have an officer working here. And our presence is in both the Allendale and Grand Rapids campuses. And as you would expect, we have 25,000 students. That's our goal, keep them safe and successfully get them to graduation just like anyone else. Sometimes we have to help guide them and educate them and get them there safely. But that's what our goal is just protect the students while they're there. One of the other things that's important for our department is parking. That falls under our umbrella currently. And that's one of the things we get a lot of questions about is whether or not to have a vehicle on campus. You'll see on the slide there about how they're available for purchase in another month, 6 weeks. It's going to cost around $400, $500 a year, depending on the permit that you purchase versus commuter versus residential. But that'll be available. That's charged to the student account. There is some discussion about whether or not a first-year student should have a car on campus. There is no restrictions to having a car on campus. Students may have one as a first year. I would add, as an alum of Grand Valley and as a student who lived on campus for a couple years, I did not have a car on campus the first 2 years. Obviously, I made it out okay. But I would say just from a personal perspective and also now as a professional, I think not having a car lends itself to a more engaging experience, more academic success, more involvement in the community, more involvement with fellow students and groups and things like that. And I think there's a lot of benefit to be had by that. Certainly there are a lot of logistical reasons to have a vehicle, but I would just submit that for consideration when you have that conversation with your student. Make sure there's specific reasons why you would want to have a car on campus, and if so, you certainly can. But there are benefits for the student to not have one on campus. So that's a little bit about an overview on ours, and I'll turn over to Susie and get her slide going. Go ahead, Susie.
Thanks, Jeff. Okay, so the Grand Valley Health Center is located, as I said, right by the water tower on campus. We are on the bus route, so you don't need a car to get to us if you live on the campus or right around the campus. It does run right to our door. We are open Monday through Thursday from 8 a.m. to 8 p.m. And then on Fridays, we'll be open 9 a.m. to 5 p.m. We do x-ray on site. We can do your blood work and lab service there. We do allergy injections if students have been getting those regularly. We do have a social worker and an RN as part of our staff that has come in very handy to help with a lot of different resources and stuff that students may need. We have 3 providers currently there, Dr. Carolyn Beal, Rocio Sanchez, and Kate Teachman. The best way to get a hold of us is through MyChart. There is an app that you can get from your app store, whichever type of phone you have, to download it. It's called MyChart. You can schedule your appointments, talk to your provider, all of that right through that app, or you can call us, of course. But a lot of times it's a lot easier just to do that through the app.
Okay, so that kind of gives you an overview about our 2 areas. And we are certainly here and available to answer any questions that you might have related to our departments. So please don't hesitate to ask those, and we'll get those answered for you.
Okay, first question. What are other modes of transportation if my student does not have a car?
So the biggest, most prominent one would be related to the bus system. So right now there's a bus system that we contract out with the local bus system within the city of Grand Rapids called the Rapid. There's 2 main routes. One is from Allendale campus to Grand Rapids campus called the Campus Connector. The other one is the off-campus shuttle that connects the Allendale campus with the bulk of the nearby adjacent off-campus apartments. Those are very popular. They're used quite frequently by students. This year's going to look a little bit different, as you would imagine, but in terms of the popularity and use, it's there. It's free for students. They just need their ID, so it's free for them to use. Very convenient in terms of time that it runs. It starts early in the morning to late at night, and it's busier during the week. Getting across campus, certainly our campus here in Allendale is very pedestrian friendly. As Susie mentioned, you can get to the campus health center just by walking across campus. Now, it's a little bit of a hike, but it's certainly not unreasonable. So students are able to do that. If you do think you want to bike on campus, that's possible. I know reasons why to do that. However, again, similar to the car, I would submit you would want a specific reason. Perhaps you have a very far class away from where you live, because often what we've found is that people just like to walk. And even in bad weather, it's a relatively short walk across campus in between classes and to and from different housing buildings. So the bus system certainly can get you most of where you need to go off campus, and then internally on campus. You can use a bike, but often we've just seen a lot of people walking around.
Okay, I have a question. I think this will be for you, Susie. Do you manage ADD medications, or should we stick with our regular PCP and just switch our pharmacy?
We do manage ADD. What we have to have is the testing done on your student or on you that has that diagnosis, and then we could do the medication from there. If your PCP is willing to just change the prescription without seeing you, it's kind of a logistical thing. That is an option. But if we are more than willing to see you and then take over that prescription also.
Does the health center have walk-in hours, or does my student need an appointment?
We do walk-ins. We recommend an appointment just because it's easier if you know you have time in between the class to know you're going to get through, but we definitely do walk-ins. And I would say probably 80% of our appointments in a day are scheduled that morning. So we're usually pretty open at the beginning of the morning. And so if you're sick, to give us a call first thing in the morning, we can get you in that day. or we do walk-ins. It just means you'll end up waiting a little longer if we're busy at the time that you walk in.
Something I'll add here while we're waiting a little bit, there's been a lot of questions about, the safety of students. And while our safety isn't necessarily directly related to COVID and health, one of the things you tend to highlight is about alcohol and drug use is having a conversation with your son or daughter and student about, what their thoughts and perceptions are and what they should or should not do as they go into a fall and start their college career. There's a lot of new things, like I said, with alcohol, where it's just simply having a discussion and making sure that there's an open line of communication between you and your student and the supporter, and just trying to figure that out. I would say probably very similar related to the COVID virus, and just talking about, hey, let's talk about masks. Let's talk about how we're going to live with people here on campus together, commuting back and forth, having some discussions, being informed together, I think will be the best way to set yourself up for success.
And just to tag off that point with Jeff too, for the campus health center, right now we're pretty much doing registration from outside the building because we can't have people all gathering in the waiting room. So that's where the walk-ins will be kind of questionable and where we're at when, school actually starts. So it could change a little bit, but we will definitely figure something out.
Okay, do you have the capabilities of doing video visits for sick visits?
We sure do. We do them every day still.
Great. Does the police department handle issues at the off-campus apartments too, or just on campus?
All right, so as you would expect, our focus is on campus. The way that our university is set up specific to Allendale is there's a very large number of off-campus apartments just across the road. Around 6, 8, maybe even, it might be actually closer to 10,000 people that live right off campus. That is the primary enforcement area of the Ottawa County Sheriff's Office. However, our working relationship and agreements with them do allow us to come off campus if needed, but that's not a primary focus. We're not going off there on our own to go out there and engage. Those usually when they need help. Very similarly, if we needed help on campus with something, we call them to help us. Those are just neighboring agreements that we have with each other. So while it's possible to see a Grand Valley police officer off campus, that's not our primary function. I would say very similar with the Grand Rapids Police Department downtown. However, we don't have as much on-campus housing. So our impression and our stance during the day is more related to business hours with commuters coming in. And we don't have quite as much police activity downtown on our campus, but we do facilitate the safety and security of that area that we do police downtown.
Well, we have a little lull. I can let you know a little bit about how billing and the office works also. The health center does bill your medical insurance for visits seen. It is billed as a family practice office, not an urgent care, which sometimes carries a higher copay. So we do bill most major insurances and a lot of the smaller ones too. So.
And Susie, can you maybe speak to whether the health center has a pharmacy or not, and what a student would do if they need a prescription filled?
Sure. The health center does not have a pharmacy. If they do need a prescription filled, there are a couple of pharmacies that are on the bus line that we would call that prescription into, and then they could get either themselves through the bus line or have somebody help them or go get it for them. But we do not have a pharmacy on campus.
What happens if my student gets locked out of their dorm at night?
That's an issue generally going to be taken care of by housing. Housing has staff members in each community on duty 24/7. So it's often reasonable that people would call the police department for help with that, but they're going to be directed back to their housing RA, the resident assistant. The contact information is usually very highly visible and posted on the exterior door, but if you forgot your key, you can't get in, so that they can best facilitate getting back in. So housing is generally going to be the one that's going to take care of that.
Okay. Our current health system uses MyChart. How do we communicate with Gvsu Health Center if we already have that app? Is there a way to designate you as a provider, or is this maybe an IT question?
You can actually, I believe, go into the MyChart app and add in Metro Health MyChart. I think you can have access to 2 or 3 at the same time. If not, then yes, I would set you up with our IT, but you should be able to use both without a doubt.
All right, well, we're still available to take some questions, and we'll share kind of the contact information related to us. You can see for the police department, the number for our dispatch, which similar to an officer is always staffed by a person. If you call that number anytime, you'll get a response by a dispatcher. Parking, as I mentioned, another source of a lot of questions that's working mostly during normal business hours. But they are available to ask your questions related to parking. For us as a police department, we do provide a lot of information on social media, Twitter, Instagram at Gvsu Police. It's a good way to kind of see how things are happening here. We do provide information that is both proactive and then subsequently informative based on what's happening, some tips and tricks and education and things like that, but also information related to traffic issues, special events, things like that. And you can see both for us and the Campus Health Center, our part of the website for you to be able to go to, visit, and poke around there. That's going to probably answer a lot of your questions, but we're certainly more than happy to talk with you about any that you might have either today or in the future.
Yeah, I would just add again, we realize that these questions are probably going to continue to come up as you're processing all this information and as things change. So definitely feel free to reach out to individual departments. You know, we are all around all summer and eager to help you. Susie and Jeff and I will hang out for a few minutes, but kind of seems like there's a lull in the questions. So if that is it, thank you again for joining us. We really look forward to seeing you and your student in the fall, and have a great afternoon.